Hi, this is Kerry Assil, and I'm demonstrating here the benefits of a wide temporal hinge and why that wide hinge needs to sit in the temporal quadrant and provides a more tectonically stable flap for us when we do LASIK, and has a number of benefits. So as we've created the flap and we reflect it back, we notice that the hinge is quite wide, and now the ablation, of course, occurring in the horizontal stays off of the hinge as well. The entire projected reticle is falling onto stromal bed, both 9 millimeters in the vertical and 9 millimeters in the horizontal. And this is because we created the flap in an elliptical fashion, wider in the horizontal than the vertical. So it's an elliptical flap in the temporal quadrant-based hinge and a very wide hinge. These provide us a myriad of benefits. The wide hinge here about 65 degrees. The OBL layer, you notice, is outside of the pupil, even though there's no pocket there. The absence of a pocket is afforded by the fact that the hinge was far from the pupil, and the absence of that pocket enables us to spare the long ciliary nerves and thereby end up, we think, with less dry eye, because the temporal long ciliary nerves are all spared. Only the nasal ones are cut by the creation of the flap. And the fact that the flap is tectonically stable here is demonstrated by putting a drop of Pret Forte onto the cornea, and we see that the gutters don't light up whatsoever anywhere with the Pret Forte. The pupil, of course, is far from the temporal limbus, and it's closer to the nasal limbus, and it's even closer to the superior limbus, and this is what enables us to have the expansive space temporally to create a super wide hinge. And by creating that super wide hinge and having it far from the pupil, we believe that we benefit in multiple ways. Of course, one of the obvious benefits is the fact that the ablation can land entirely onto the stromal bed. Other benefits are that the wide hinge makes the flap more tectonically stable, so we see less incidence of epithelial ingrowth, less incidence of microstria or slipped flaps, and also the temporal zone is the only zone of the eye where there's no bony prominences. There's not the brow ridge or the nasal ridge or the maxillary ridge, and so that's the zone that's most accessible for trauma, and this helps to protect it in that way as well. So we've noticed, we think, some less dry eye in these patients, and also possibly slightly better visual outcomes by virtue of the fact that the flap is much more tectonically stable.